Welcome to Review Central. This is Nursing Licensure Exam Reviewer number 2. This reviewer is intended for those who are eyeing, or are set to take the Nursing Licensure Exam, given by the Board of Nursing and administered by the Professional Regulation Commission of the Philippines. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous nursing licensure exams. Let's begin. Please refer to this situation for questions 1 to 5. Situation number 1. Kathy is a newly registered nurse who is assigned to conduct a lecture on fertility awareness among young women. Question number 1. Which phase of the menstrual cycle promotes the uterine lining to grow and thicken to an 8 to 10-fold rate? A. Proliferative. B. Menstruation. C. Ischemic. D. Secretory. The correct answer is A. Proliferative. The first phase of the menstrual cycle is the follicular or proliferative phase. It occurs from day 1 to day 14 of the menstrual cycle, based on the average duration of 28 days. The variability in the length of the menstrual cycle occurs due to variations in the length of the proliferative phase. After about 5 days, estrogen levels rise and the menstrual cycle enters the proliferative phase. The endometrium, or the innermost lining layer of the uterus, begins to regrow and thicken to an 8 to 10-fold rate, replacing the blood vessels and glands that deteriorated during the end of the last cycle. Question number 2. Kathy discussed the signs and symptoms of ovulation. Which of the following is not included? A. Weight gain. B. Increased quantity and pH of cervical secretions. C. Rise in basal body temperature. D. Breast tenderness. The correct answer is A. Weight gain is not a sign or symptom of ovulation. The signs and symptoms of ovulation include, but are not limited to: increased quantity and pH of cervical secretions, rise in basal body temperatures, breast tenderness. Weight gain is not among the signs and symptoms of ovulation. Question number 3. One of the participants asks, when does ovulation take place? Kathy's answer will most likely be A. As soon as her menstruation stops. B. On the 14th day of her cycle. C. On the 14th day before the next menstruation. D. At the time her basal body temperature drops steadily. The correct answer is C. On the 14th day before the next menstruation. Ovulation is the process in which a mature egg is released from the ovary. After it's released, the egg moves down the fallopian tube and stays there for 12 to 24 hours, where it can be fertilized. In an average 28-day menstrual cycle, ovulation typically occurs about 14 days before the start of the next menstrual period. Question number 4. Cora, one of the participants, asks how many days is her menstrual cycle if she had her previous menstrual flow last March 26 to 30th, 2022 and her last menstrual period on April 24, 2022. Kathy's response will likely be A. 28. B. 29. C. 30. D. 31. The correct answer is C. 30. To compute for menstrual cycle, begin on day 1 of period and count the number of days until the next period, which is day 1 of the next cycle. Track for 3 months and add the total number of days. Divide that number by 3 to have the average cycle length. Ovulation normally occurs 12 to 16 days prior to period. In the case of Cora, day 1 of her period was on March 26. Counting the days from March 26 to April 24 will yield 30 days, the length of her menstrual cycle. Of course, as noted earlier, Cora should track her menstrual cycle for 3 months and take the average to establish her cycle length more accurately. Question number 5. Which of the following is a function of estrogen hormone? A. Inhibits uterine contractility. B. Elevates body temperature during ovulation. C. Promotes female secondary sex characteristics. D. Promotes lactation. The correct answer is C. Promotes female secondary sex characteristics. Estrogen regulates the growth, development, and physiology of the human reproductive system. This hormone also influences neuroendocrine, skeletal, adipose, and cardiovascular systems. Estrogen is an important sex hormone produced primarily by the ovaries in females and testes in males. Estrogen enables the following organs to function. Ovaries. Estrogen helps stimulate the growth of the egg follicle. In the vagina, estrogen maintains the thickness of the vaginal wall and promotes lubrication. Estrogen enhances and maintains the mucous membrane that lines the uterus. It also regulates the flow and thickness of uterine mucus secretions. The body uses estrogen in the formation of breast tissue. This hormone also helps stop the flow of milk after weaning. Secondary sexual characteristics, such as pubic and armpit hair, also start to grow when estrogen levels rise. Many organ systems, including the musculoskeletal and cardiovascular systems, and the brain are affected by estrogen. Please refer to this situation for questions 6 to 10. Situation number 2. To develop respect and love for the profession, every nurse must have a good grasp of its historical developments, including the important personages and their contributions. Question number 6. Which of the following is considered the pioneer country in modern nursing? A. England. B. United States. C. Denmark. D. Germany. The correct answer is D. Germany. Although much of modern nursing as we know it today is associated with, and credited to Florence Nightingale, the acknowledged founder of modern nursing, who was an Englishwoman born in Italy and raised in Britain, it was actually pioneered in Germany. Modern nursing began in the 19th century in Germany and Britain, mostly in Germany, and spread worldwide by 1900. The roots of modern nursing can be traced back to the deaconesses, also known as diaconates, in the mid-1800s to mid-1900s. The diaconates were women who obligated themselves for 5 years of service, receiving room, board, uniforms, pocket money, and lifelong care. They were trained in nursing, child care, social work, and housework. By 1890 there were over 5,000 diaconates in Europe, mostly in Germany. By 1957, there were 46,000 deaconesses and 10,000 associates in Germany. It is important to also note that Florence Nightingale went to Germany to study nursing early in her career. Question number 7. When was the spirit of nursing thought to have started? A. Time when hospitals and schools of nursing were established. B. As early as civilization. C. Florence Nightingale time. D. During the establishment of universities, colleges, and schools of nursing. The correct answer is C. Florence Nightingale time. The evolution of the nursing profession has led nurses from households to hospitals, schools, and outpatient clinics. As one of the oldest occupations, nurses have faced and inspired an array of changes. The most remarkable not only raised the profession but patient outcomes and the overall state of healthcare. The spirit of nursing and nursing as a profession emerged in the mid-19th century. Historians credit Florence Nightingale, a well-educated woman from Britain, as the founder of modern nursing. Nightingale challenged social norms, and her wealthy parents, by becoming a nurse. Nightingale developed and implemented action plans to improve sanitary conditions and made hand-washing, bathing, and other principles of asepsis and infection control mandatory. During the Crimean War, she and her team applied these techniques and reduced their hospital's death rate by 2/3. Question number 8. Which of the following achievements of Florence Nightingale has the greatest impact on the professionalization of nursing? A. Establishment of St. Thomas Hospital School of Nursing. B. Being the leader of a religious order devoted to nursing. C. Her training in Kaiserswerth Hospital. D. Her work during the Crimean War. The correct answer is D. Her work during the Crimean War. Florence Nightingale came to prominence while serving as a manager and trainer of nurses during the Crimean War, in which she organized care for wounded soldiers at Constantinople. She significantly reduced death rates, by approximately 2/3, by improving hygiene and living standards. Nightingale gave nursing a favorable reputation and became an icon of Victorian culture, especially in the persona of the lady with the lamp making rounds of wounded soldiers at night. Question number 9. In which of the following periods in the development of nursing did nurses learn their skills through formal curricular program and clinical training? A. Contemporary. B. Intuitive. C. Apprenticeship. D. Educative. The correct answer is D. Educative. The first period in the development of nursing is called intuitive nursing. This period covers from prehistoric times up to the early Christian era. During this period, nursing was essentially untaught and instinctive, performed out of compassion, and generally belonged to women. Intuitive nursing was followed by apprentice nursing, from the founding of the religious orders in the 11th century up to 1836, with the establishment of the Kaiserwerth Institute for Training of Deaconesses in Germany, the same school where Florence Nightingale studied nursing. This period is also referred to as period of on-the-job training, during which nursing was performed without any formal education, and by people who were directed by more experienced nurses. The latter part of this period, from the 17th century up to 19th century, is also sometimes referred to as the dark period of nursing, during which nursing became the work of the least desirable of women. Next came the period of educated nursing, also known as educative period. This period began on June 15, 1860 when Florence Nightingale School of Nursing opened St. Thomas Hospital in London, which opened the door for nurses to learn their skills through formal curricular program and clinical training. During this period, development of nursing was strongly influenced by trends resulting from wars, from an arousal of social consciousness, and from the increased educational opportunities offered to women. The last period is called contemporary nursing, which covers the period after the Second World War to the present. This period has been marked by scientific and technological developments as well as social changes. Question number 10. Which of the following triads of schools of nursing were first established in the Philippines? A. St. Luke's Hospital, UST Hospital, Manila Doctors Hospital. B. Philippine General Hospital, St. Paul Hospital, Mary Johnston Hospital. C. Philippine General Hospital, North General Hospital, Baguio General Hospital. D. Iloilo Mission Hospital, St. Paul Hospital, Mary Johnston Hospital. The correct answer is D. Iloilo Mission Hospital, St. Paul Hospital, Mary Johnston Hospital. The very first nursing school in the Philippines was the Iloilo Mission Hospital of Nursing in Iloilo City, which was established in 1906. It was followed by 4 other nursing schools in 1907, namely St. Paul Hospital School of Nursing in Manila, Philippine General School of Nursing in Manila, St. Luke's Hospital School of Nursing in Quezon City, Mary Johnston Hospital School of Nursing in Manila. Of these 5 pioneering nursing schools, the Iloilo Mission Hospital, St. Paul Hospital, and Mary Johnston Hospital are acknowledged as the triad of nursing schools first established in the Philippines. You have just completed Nursing Licensure Exam Reviewer number 2. If you wish to watch more Nursing Licensure Exam Reviewers, check out our Nursing Reviewers playlist. If you haven't done so yet, please don't forget to subscribe to Review Central and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful, and feel free to share it to anyone who may also benefit from it. We wish you all the best on your forthcoming nursing licensure exam, and we look forward to your fulfilling career and professional life as a registered nurse in the Philippines. Good luck and God bless.